He is the General Secretary of the World Medical Association. He's a very, very dear friend of mine, of the Israeli Medical Association, of Israel in general. And he is a clinical professor in health administration. He is also, if I'll go and I'll talk as how many things he has, there is just too many things to do, but in any case, clinical professor in health administration at the Brooks College of Health, University of North Florida. He was, I don't think you still have, the Deputy Secretary General of the German Medical Association. He has an MD and a PhD from the University of Cologne. He is a postgraduate fellow of the Department of Biochemistry at the University of Minnesota. And he holds an honorary doctorate of Victor Babis University in Romania. And this is just a few of the things. Otmar has been, as I said, a true friend and gone through the different trends and processes of the WMA and the transformation of the healthcare sector, and especially of physicians. He's been a great champion for the profession in various international bodies, WHO, WTO, and very other organizations. That is as well as looking at the core, one of the core aspects of the WMA work, which is the ethics. And of course, when we're going into the world of innovation, there also are a lot of questions that have to do with ethics. So without further ado, I would like you to welcome Otmar Kloiber.
Thank you very much, Leah, for your very kind introduction and the long cooperation which we have and friendship which we have. And thank you also to Professor Haggai for inviting me here to this conference. This is the right place to be for this, simply because Israel is spearheading healthcare technology, but not only that, and maybe to my heart more important, it is also spearheading universal health coverage, really to bring people healthcare to all people in the world. And what I would like to do is I would like to speak about ethical concerns in the implementation and innovation of healthcare and how we try to tackle this at the World Medical Association. And in this presentation, I'm taking a few minutes and say a few words about the World Medical Association, what it is, because I guess that most of you don't know the World Medical Association, or may have just heard about it, but don't know really what we do and how this relates also to the question of innovation. And you will see there is quite some crucial and relevant connection between that. I would like to give an overview of concerns and safeguards when it comes to technology development in very few simple words. And I would like to introduce at least two of our core policies which are directly related to research and innovation and what they have to do, especially also with the high-tech innovation which is before us, and finally to give some conclusions to you. So let me begin with the World Medical Association and its start after World War II. There was a previous organization, the Association Professionnelle Internationale de Médecins, which ceased to exist at the beginning of World War II, based in Paris, and then already in 1945 and later 46, some medical associations from around the world met in London to decide that there should be a new medical association. And if you look to the date of the foundation, 17 and 18 September 1947 in Paris, this is actually just 1 month after the end of the Nuremberg trial, the doctor's trial in Nuremberg. And this has, at that time, shocked the world when they knew or learned what has happened in medicine and in medical research in my own country, in Germany, how horrifically medicine and research could be abused to torture, to kill people. And at that trial, there is the so-called Nuremberg Code, which is one of the documents which is nowadays often referred to as a code regulating what research is. Actually, this code got forgotten after that. and it only resurfaced in the 70s when historians looked at that. What to me personally is the most important conclusion for that is that we as physicians, that everybody of us is individually responsible for what we do. And we cannot hide behind commands or behind a general societal attitude or a government or whatever. The court said, no, you yourself have to think, and you yourself have to test it to your morality and the ethics. And I think that is a key statement that came out from that, which also has shaped the World Medical Association, which now has grown. We take only one medical association as a member from a very few medical associations in the very beginning in 1947 to now 116 medical associations. By the way, at that time, the Israeli Medical Association was one of the founding members of the World Medical Association. I think it was then called the Jewish-Palestine Medical Association before it became the Israel Medical Association, but it was part of the foundation of the World Medical Association. We are organized with certain bodies. We have our General Assembly is the highest body which takes all the decisions on the policies which we make. We have a council with 3 committees that meets biannually, and we have an executive committee that meets on demand, or usually once per month. We have a very international leadership, and I have our presidents with us, Dr. Osan Enabulele, who will also address you. The organization is based close to the World Health Organization. What you see here is a picture of an area of Geneva, the city you see down in the town, the tip of Lake Geneva. The black line in the middle, which separates the picture, is the runway of the Geneva airport, and up to there is Switzerland. And on the right side in the corner is the United Nations campus, where also the World Health Organization is based, and on the other side is France, and we are located in France, in Ferney-Voltaire, where we have our office. What do we do as World Medical Association now? Based on this history, we mainly look that we get a consensus of what is medical ethics and deontology in this world. And that is what we are doing for most of the time. We always have been looking also on the social side of healthcare, looking nowadays very much in social determinants of health, looking into our environment. We're very engaged with the Conference of Parties, the COP, on environmental issues. We represent the physicians to the countries. We support regional and national medical associations on demand, and we do projects along this line. Some of our policies, and I will come back to that later, but let me just mention a few of them, have become core policies for most of the national medical associations. The Declaration of Geneva as a new modernized Hippocratic Oath, very recently, 2017, brought into a new shape. The International Code of Medical Ethics, just now, a month ago, a little bit more than a month ago, we had a new version of this international code, which is kind of the blueprint for many of the national medical ethics codes in this world. And then 2 documents which are crucial for the question of research and applying technology into medicine. The Declaration of Helsinki, which relates how physicians should act when doing research, and especially experimentation, including human beings. And we have the Declaration of Taipei, which extends these ideas of ethical behavior during experimentation and during research into the virtual world. And I will come back to that a little bit in a moment. There are other policies which have become quite important. And let me just say, some of these policies have made it into national laws, like the Declaration of Helsinki. Some have made it into international contracts, like, for instance, the Declaration of Helsinki into the European Trials Directive. So these documents have gotten a lot of weight in that, and also the International Criminal Court in The Hague uses those documents from time to time when it comes to judging about the behavior of physicians. Now, the basic tension which we always see is that we want to bring together the advancement of science, but we want to have it under the observation of our ethical principles. And some people say, well, that's a little bit difficult, you know, if I have to observe all those rules. Are there contradictions? That is a good question which we will have to deal with. So let me just give you a few insights where we see ethical concerns in the implementation of innovation in healthcare. As we continue to advance in technology and innovation in the field of healthcare, it is important that we also consider the ethical concerns that may arise from the implementation of these new ideas and practices. One of the main ethical concerns in the healthcare industry is the protection of patient privacy and sensitive information. With the increasing use of electronic medical records and health data, there is a risk of unauthorized access and misuse of this information. It is crucial that we have strong security measures in place to safeguard patient privacy and that we obtain proper consent before sharing personal information. Another ethical concern is the potential for unequal access to healthcare, particularly for marginalized communities. As we develop new treatments and technology, we must ensure that they are accessible to all individuals, regardless of their socioeconomic status or other factors. In addition to the use of artificial intelligence and machine learning in healthcare raises ethical questions around bias and fairness. It is important that we carefully consider these issues and take steps to mitigate any potential bias in the data and algorithms used in these technologies. Ultimately, the key to addressing ethical concerns in the implementation of healthcare innovation is transparency and communication. We must be open and honest about the potential risks and benefits of those advancements. And I think we actively engage with all stakeholders, including patients, healthcare providers, and the broader community to ensure that we are making informed decisions that align with our ethical values. So the two care documents which I mentioned before, which I think have a high relevance for this field of technology development and research, are the Declaration of Helsinki, which aims to facilitate research involving human beings. It is, by the way, from 1964. Some people say it is the successor to the Nuremberg Code, but actually from our archive we cannot confirm that this is indeed the case, although there is a lot of similarity between the documents when you look at them. We also want to protect with this document study subjects against dangers and experimentations and exploitations, and that of course has also been the core of the Nuremberg Code. By which mechanisms is this being done? Ethical, methodological correctness, informed consent, advice and permission by ethics committees, obligation to make public. So there is a whole set of rules which tries to ensure that documents are being done correctly. Now, in the Declaration of Helsinki, we were dealing with the classical experiments. They are usually single research applications. They are defined with a very clear protocol for this one experiment. They have one aim. They have a clearly defined risk. We have a defined timeline. We know who is the holder of data, who does what with it. We have a defined benefit, or at least an expected benefit. We have high cost per data set because those are usually gained by this experiment. The data has to be collected during the experiment. Subject data is usually identifiable, and intellectual property questions usually don't play a role for the participant in the study. Now we found with doing experiment in a virtual world, this changes, of course. Now you may say, well, in a virtual world, where is the danger? You do not touch anybody. There's no blood running. You don't any interventions directly on a body. That's correct. And most likely the dangers, at least the physical dangers, are close to zero. And no, they are much lower. They're not close to zero. They are much lower, and in most cases probably not as dominant and relevant as in a physical experiment, which we do. We have heard earlier, of course, and I think those were very mindful applications that have been shown here, that you may, for instance, use artificial intelligence to predict dangers and then to preempt a dangerous situation. But there are likewise systems which use data and the virtual data space to exclude patients from treatment by rationing or by triage. And of course, that may be a question of life and death for you in the end. So the use of the data space can be as well preemptive to prevent danger. It can also be used in order to do things which maybe the data donator doesn't want to see. And of course, when we collect data, then the situation, they have data banks or biobanks as an analog to databases, then of course we have different characteristics on how we work with that, and of course then different situations on how we can protect the subjects in the database or the specimens in the biobank. So there is probably with each data bank and biobank multiple use. There are very different protocols that will be used with them. There are different aims you would follow, which all lie in the future, and you may not know when you collect the data or collect the specimens. So a risk cannot be described and cannot be defined as what you need for the Declaration of Helsinki and to make an informed consent. The timeline is unknown. The holder and the user of the data may be different parties in the virtual research, or usually there are actually. And you may not know from the beginning who is using the data. And this is, again, is different from the usual classical situation, like in a clinical trial where you have clearly a sponsor of the study who wants to get some data, for instance, on a new drug there. The benefits are likewise undefined. You don't know them because it's all in the future. But there is a low cost of a data set because the data is already in the biobank or in the database. The data set is readily available. And the user ID may remain anonymous or coded, and IP questions may be relevant for the community which gives the data, so you don't want to see that a community is being exploited for harvesting data, and at the same time they cannot take any advantage of what is being done with the data. So the solution which we have tried to find to transport these technological developments and the experiments from the real world into a virtual world is by setting up a new type of guideline, the Declaration of Taipei, which extends then the meaning of the Declaration of Helsinki into this virtual world. And what we expect is that before a database or biobank is being set up, that there is an ethical review of the justification for having this database. Now, that is a very basic principle because it should not be too difficult to give a good ethical, acceptable reason to set up a database or a biobank. But it should be done in the first place. And then there has to be a consent of those who give data into this database or biobank, which is based on the information about the purpose and the procedures, the governance of this database. As I said, you cannot say about the risk and the benefit because they lie in the future. You don't know them. And there may be very, very different protocols which are run on this data and which are run on the database. But what you should be able to tell people is how you guard the data, how you protect the data against abuse so that they cannot be turned to the detriment of those who have given the data in the beginning. So each use then of the database should have an ethical review by an access committee or an ethical committee with any use of this biobank or database. And then this committee should determine whether it's fine to use the data because there is no repercussion to be feared to those who have given the data or the specimen, or whether there should be additional safeguards in place which then protect the donors of the data or the specimen. For instance, anonymization, aggregation, or if necessary, that the people who are doing the experiments using the data will have to ask for consent because there may be repercussions, there may be accidental findings going back to the person which has, or the persons which have given the data. Now, there are new technologies around which also address those questions. For clinical trials, for instance, there may be a clinical trial tokenization that may help to produce anonymous use of this data. We will have to look into those technologies, whether they are really solid enough in order to protect individuals. There may be another model that I think has a lot of promise, that is federated learning, where different data sources are being brought together, but the data sources does not leave really the housing where it is in, so it is protected against an unauthorized sharing with that. So let me conclude. In conclusion, as we continue to push the boundaries of what is possible in healthcare, it is essential that we prioritize ethical considerations in the implementation of innovation. And by doing so, we can assure that these advancements serve to improve the well-being of all individuals and communities and benefit society as a whole. And before I thank you, I have to make a declaration here. The summary and the conclusions I didn't write. What I did is I asked artificial intelligence to write it for me. And what you have seen here as the summary and also the conclusion on this has been done by ChatGPT. I wrote in the question, write a speech about satisfying ethical concerns in the implementation of innovation in healthcare, and that what you have heard was a result which I got in 10 seconds. I thought that was already pretty good. Now, of course, I have added the parts by the World Medical Association, our policy work that we have done, but it shows that those systems are really very strongly developing and will aid and help us in all fields. Now, of course, ChatGPT, when it doesn't know what to say, it is happily giving you some funny things with that. So at the moment, it's probably better for political speech writing than for science speech writing. But nevertheless, I think that was a pretty good example on how artificial intelligence will influence all of our lives and all of our work. We have heard this morning, how strong that influences our clinical treatment, but it is really coming to all of our workplaces and all of our work in the future. Thank you very much for your attention.